turnout for this morning's first panel, but you know what? We have to respect everyone's time, and we are going to start with our first panel discussion very shortly. I would like to take this opportunity to introduce myself to you if you have no idea who I am. My name is Maxine, and so many of you come up to me and ask me, where are you from? I cannot figure it out, blah, blah, blah. I'm from South Africa, Johannesburg. Yeah, the not so great part. The not so great part. If you've ever been to South Africa, you know that Cape Town is where it's at. It's beautiful. Yes. See, they already, I love it, I've been there. Yeah, Johannesburg, not so much, not so much. All right, it's an absolute pleasure to welcome you to the third and final day here at the Health 2.0 conference. I'd like to give a special, put this down because I'm not that tall. See, I try to add some height today. It's all right, that's just between you and I. So I also want to take a moment to express our sincere gratitude to our valued bronze sponsor, Lifespin GmbH, for the support and partnership, which have been crucial to making this event a success. Now, our first panel is going to be discussing the intersection of medicine and innovation that involve the role of physician innovators. I'd like to welcome the moderator of the session, Dr. Nikos Katsibalasis. I got that right, yeah. Dr. Arun Castro, Dr. Hitendra Singh Kanwar, Wissam Yassi, MD, Dr. Alexander Filipovic, and Yvonne Schimmer. The stage is yours. I'm going to go find Arun. Maybe he ran off to the bathroom.
Good morning, everyone. It's a pleasure and a privilege to be here among you. And it's a better privilege being among these people. And we have Dr. Arun is missing, but we're waiting for one more in our panel. So we are speaking about innovation in medicine and how we can make things better for practitioners and mainly for the patients. So let me start by presenting our beautiful panel, and I will start with this dear friend from the Netherlands, and I would like him to present himself and talk about the nice things that he was researching and he's innovating with in cardiology.
Thank you very much, Nikos. I hope this is on. Good morning, everybody. Selected public. So we love you already. My name is Wissam Yassi. I'm an imaging cardiologist based in the Netherlands. So my daily bread and butter is advanced cardiovascular imaging with CT, MRI, and echo. And I caught a virus during the COVID, which wasn't COVID, but it was innovation. And it started because of the need in the clinic. And that's why actually that ignited my endeavor to innovate and by creating an app in which we can monitor the patients from a distance, a telemonitoring app. So this is in short my story.
It's a lovely story, and you know, something always inspires you, and you can create miracles. So if we can please ask the next doctor to present himself, I will be delighted.
Thank you, Nikos. So I'm Dr. Kanwar. I'm emergency medicine physician. Currently I'm working in Southeast London Trust as a clinical director for urgent and emergency care. I think innovation is, something which is very crucial at the moment because it's a very complex healthcare. Post-pandemic, we have seen, surge in the walking emergencies as well as the ambulances. In spite of our reallocation of sources, a brand new ED, we could not cope. And then we thought we need to work differently. And then we use technology as a catalyst. So we developed a new software. We were using the past, but it's like, you go to the radiology section first, then you go to the clinical section, then you go to the vital impact, to see, and nothing is connecting. I call it data silos here. So basically I'm not getting any alert. So what we did is that we speak to the GP networking, we speak to our CEO and CO that can we have a three interface, which is like a data from the GP, so we know the background, and then data from the hospital, everything on one page, and then we connect it to the ambulance services, which is independent. So we know that how much burden we are having, what is our priority, and we could do the electronic triage rather than doing triage in emergency. And that's how we launched the new SPOA, so that's a single point of access. And I think that brought a brilliant change in that healthcare, especially for the front end. That's my story.
That's very nice. That's very nice. We want to have more information about that. So I would like also to present Dr. Alexandra, who I'm a great fan of her. And please, Alexandra, tell us something about your side and your innovation.
Thank you, Nico. Good morning, everyone. Thank you for being here with us this morning. My name is Alexandra Filipovic. I'm a medical oncologist at Imperial College London, and I'm the head of oncology at a Boston-based clinical stage biopharma company called PureTech Health. The innovation for me also penetrated fully during COVID, at the onset of COVID. And the way it manifested for me is an awareness that struck me one day in clinic, just before I called my first patient in. You know, after nearly 2 decades of doing this work, I walked into the clinic that morning and all of a sudden, something was different. And the feeling that I had was that it was no longer enough to just give patients a prescription, a blood test, and a scan result. I felt that I needed to start offering something more. And what that looked like was my desire to start training in holistic care, and the innovation that is now embodied and is in practice is the integration of medical care as we know it and whole body intelligence.
That's lovely. And in fact, I'm very happy to see that in this conference, both days, we were speaking about holistic approaches. So seeing someone like you with this background speaking about holistic medicine makes me feel great scissors. So I will have to tell you about my background, and I will be delighted to speak with you about what really holistic medicine stands for. But now, I would rather introduce my other colleague and a good friend, Yvonne Simmel. Yvonne, can you please introduce yourself to the audience?
Yes, good morning everyone. My name is Yvonne Simmel and I'm from the Netherlands. I'm a holistic practitioner, so indeed holistic. And that is so important that we treat the patient as a whole. It's not only physical, it's not only mental. You have to look at the whole picture. And I'm also a nutritionist, so it's so important to look at the nutritional part of health. And I kind of miss that here in this conference because it's so important to look at the nutritional side of it. I'm also an intuitive coach, and then you come back to the holistic approach. It's not only that you have to look at the facts, but only see what's going on with someone, what's their trauma in life, what's emotional blocking them. And with being an emotional or an intuitive coach, I can look at that. Next to that, I am an author of a #1 bestseller, co-author with the famous Marie Diamond. And I just published my own book about nutrition, Eat Well and Uncover True Health. It's a book about the facts about nutrition, the do's and the don'ts, and the myth about nutrition, what they all told us, what is not true. So a lot of lies about nutrition, and that's very important that we get aware of it. Next to that, I work with a Dutch company who does DNA research, and I think that's also one of the tools that will help us to a better and quicker diagnostic. And of course, I'm working together with Nikos, and we use a body scan, a medical device, and I'm already working with that for the last 10 years. And it can be so easy to diagnostic someone with a medical device. Often it happens that the people go to the regular doctor and they give you a medicine, and then that doesn't work. They send you to the hospital. They have no clue. And then that patient comes to me. And then often with a nutritional help to change their diet, or give them supplements, or even just listen to them. What's going on in their life? What is it that they're feeling? And that is something that we have to educate the doctors, that they have to listen better to their patients.
That's very nice, Yvonne, and maybe that's the philosophy. And speaking about oncology, we have in the past we have a very nice talk with Alexandra. And although this is a danger zone, there is a big gap in oncology. And I listened to the panel yesterday speaking about oncology and holistic medicine. The fact is that doctors in oncology leave the patient after they finish the whole protocol with nothing. The root cause of cancer is usually based in toxins, in toxicity and genetics. But when we finish with treating the doctor, even if he's operated, or even if he's going through a chemotherapy or any other treatments, nobody ever cared about his mental status, his depression, the toxicity in his body. He's even worse because he's gone through a shock. So if we want to have a good prediction for this patient, it's a must that we could do something holistic. Removing the toxicity, improving his mental health, his emotion, and his energy field. And that's something I'm going to talk about later. So finally, I will introduce my friend, Dr. Arun. He is a doctor that you would like to live with him, work with him, because when he will tell you what he's doing, you will be impressed. Please, Dr. Arun, if you can present.
Good morning, everyone. My name is Dr. Arun Castro. I am a tour doctor. I work in performing arts medicine, so I work with agents, artists, and production companies looking at optimizing the health of their teams. So it's about a holistic approach, looking at those that are on stage and those in the back supporting the show, and optimizing their health before performance, during performance, and then after. So a big shout out to our production team. You guys have been here all week, working, unsung heroes, working 12-hour days at least to put this show on. And really, my company, Brody Medic, borrows from sports medicine. It borrows from principles of prevention in terms of physiotherapy. We look after musicians with their guitarists and their musculoskeletal repetitive strain injuries. We help vocalists with vocal health coaching beforehand. And then we also have a proposition where on tour they can use our telemed app to get access to a doctor. Because one of the problems in the field is lack of continuity, lack of access, and lack of bespoke care from people that understand the nature of the music industry. So essentially that's the journey that, starting out as a doctor working at various festivals in the UK, 26 over the last 6 years now, I could just see there was an unmet need amongst that group. And the more and more I thought about it, I just love being around music, and I love being part of the scene. I just thought I have to do something, and for me, I guess that's where my innovation story comes from. It's just seeing how do we meet that unmet need. And we'll get into the problem a bit later maybe, but back to Nikos.
So, that's amazing. You see, everyone here has its own story of his innovative pathway. And I would like to present also myself. I'm Nikos Hatzipalasis, I'm a naturopathic doctor. I have trained in different modalities for many years. I have a PhD from Switzerland based on my research on the human biofield and the interaction in complementary medicine. And I have some studies in homeopathy and a postgraduate degree in homeopathy. But the thing is that through my experience with thousands of hours of assessments, I realized that holistic medicine is the only approach. And the thing is that we are talking about the revolution of technology and artificial intelligence. And this is very important, that it's digitalization, AI. But if we do not come to a point to realize that the biggest revolution of this time is the revolution of awareness, the last decade people are becoming more and more aware that something bigger than the physical body is here. And the thing is that this awareness is projected to the need for holistic medicine. If you can see the statistics, in the United States, I have a presentation, but I wasn't able to present it. In only United States, the turnover of holistic medicine was something about 150 billion in 22, and they expect it to triple in the next 5 years. So you see, the market is demanding for holistic medicine. So the institutes, medical institutes and medical doctors must target in holistic medicine. And if you want to be targeted in holistic medicine, you have to be trained properly. So there are different levels to approach this subject. The first is who is going to train holistic doctors and what is his background. And the second thing is we have to make some structure. Because when we ask, what is holistic medicine? A doctor will reply something like, we treat body, mind, and soul, we treat the emotions, the mental, but they do not really know what's the soul about. And because I want to put science in everything, I connected what we call soul with the human biofield. So the human biofield is the energy field that is similar to your physical body, it's connected with everybody. This is part of a big research for many doctors all around the world, which I have the privilege to connect with our academy. And the research of the biofield is so vital because that's where the disease is primarily manifested. So if we can see the texture of the biofield and we can understand that all the emotions, all the mindset, the thoughts, all the database, all your drama is allocated first primarily there and not in your brains, then you will start researching about very old therapeutic systems from Hippocrates, from Aristotle, from Chinese traditional medicine, from Ayurveda, and you can see the wisdom. So what we are doing is we have created an academy that would like to become a hub to connect all the doctors that are doing the research all around the world, a hub that will train doctors. On the first level, we created a protocol to support a doctor make a better diagnosis so he will find the root cause behind its disease. And this protocol connects different therapeutic modalities where we provide the essence, not the training, because a full training for homeopathy will take 5 years. But we will provide the essence of homeopathy, the essence of traditional Chinese medicine, the essence of herbal medicine, the essence of psychology, because we want doctors to have a better emotional intelligence, know how to approach their clients. So we have a core training for doctors, providing different courses, the essence of different courses, and we will guide them how to take information from homeopathy and see what's the indication of the personality of their client, of their patient, how they get some connections, energy connections from traditional Chinese medicine. And this is the core training. And after that, we have doctors presenting their research and providing their own trainings. We have a doctor from Germany providing a research and the training about autism with frequency medicine. We have the privilege to have Dr. Alexandra with us, and who is providing a course about oncology. We have a doctor working from Greece, and he's done a great research, providing a course about quantum medicine, and he connects this information with ancient philosophy from Aristotle, Plato, and Hippocrates. We have a doctor doing a great research in frequency medicine from Russia. They have a very big tradition, and many other people that we connect. So you are welcome to communicate with me. Maybe you can be one that will provide the course in the future in the academy. And after that, the second part is that the academy has humanitarian philanthropic philosophy. We want to be able to fund our non-profit organizations, which will create communities, we will support communities. So it's a two-level company. The first is train doctors in a really humanitarian project, connect doctors, and finally offer back to the humanity. Sorry, maybe I took too long of the time from my speakers, and I'm very sorry about that. So I want to go back to my dear Wisdom. So my dear Wisdom, please let me know what you are offering. How do you think it's going to improve the job of practitioners? How we can improve the medical environment?
Nikos, thank you for that question, because what are we doing as a physician? Physicians in general should participate and improve our patients' health if we're going to innovate. So the innovation, what happened during COVID, was started ignited by the needs of the clinic. We developed, together with my actually best friends, top-notch technicians and developers, an app called Medcore for You, which is, we needed to devise a name, Medcore for You. So from being a cardiologist, I thought, well, a medical doctor, a cardiologist for you, to be a vendor-independent app in which we give the patients with certified devices, and we can monitor patients at home or maybe even on vacation, on a distance. We can monitor the blood pressure, heart rate, weight, and recently we introduced even the whole flow spirometry for patients with severe asthma or COPD, and we integrated also a modality, new technology to detect atrial fibrillation or rhythm disturbances, all in one app. So the idea behind it, we give it to a different group of patients. They do not need to use different apps for a different disease. We connected the app, we can connect the app to their health professionals. So an EHR of the hospital, I don't know if you know Epic, it's also used in the UAE and many parts of the world. So the app is directly connected to Epic, in which the doctors and the specialized nurses directly can see the progression of the blood pressure, heart rate, weight, and their vitals. And this way, we tested also in the Netherlands. We reduced from a very simple test only by the idea of telemedicine. We reduced the time of contact per contact 30%, and we reduced also the time, the numbers of physical visits, about 25 to 30%. I'm happy to tell you we tested that in advanced heart failure to hospitals in the Netherlands, and the feedback from the patients, it was really overwhelming, 8.8 of 10. And one of the things, the quotes we got from the patients, we got a bit emotional. Some of the patients said, I got my life back. I can do that on vacation. I don't need to go and visit the hospital that frequently. This is from the patient's experience part, but from the medical part, I don't know if you know about heart failure. It's 1% of the adult population worldwide, so it's in the millions. And we need to prescribe certain medication, which we call them the Fantastic Four, just like the movie, but there are 4 different groups of medication, and we need to titrate them in a very short period of time. The current practice would take us about more than 90 days to do that, and maybe 6 months or a year. We're using telemedicine in the right way. We do that right now within almost 12 weeks. So this is one example. And today, I think yesterday, one of the biggest non-academic hospitals in the Netherlands, OLVG, they're using our technique to monitor patients with advanced asthma. They're using young patients using biologicals, which means they should come to the hospital quite frequently just to do the spirometry, to assess the treatment. And right now we provide the technology in which these patients, they can do that at home as many times as they want. Very simple details, but at the back end, the doctors or the specialized nurses, they're going to get the whole data set with the whole curve. So these are only 2 examples, and the third one is If we are talking about the pandemic, we had the COVID, but one of the new pandemics is atrial fibrillation. And we should be very keen on treating that with the all risk factor package. So weight reduction, blood pressure monitoring, and early detection and treatment for atrial fibrillation. Because if you don't treat it, you're going to get like stroke and comorbidities in which the quality of life is going to be reduced. So this is why, you know, we introduced the idea actually was born, and I'm happy to say it's implemented for hospitals, the medical for UN.
That's very nice, William. I believe conducting with William will be a great opportunity because, you know, he's a fighter and all his life, and he's a dreamer. So he puts a target, he's focused on that, and then he succeeds. And that's why I believe he has a very humanitarian aspect, and he will be very successful.
Thank you
So
very much.
let's go to Dr. Singh. Now I will not forget your name. Please, Dr. Singh, what are your expectations, and what do you have to offer to the medical community that will make people's lives better?
No, absolutely. I was listening very carefully because wearable devices has made a great change in atrial fibrillation. So similarly, you know, on the front door, before this interfacing of three application and three, it's not application actually, it's an interface of three network, primary network, hospital network, and the network from the diagnostic. It brought a big change. So we constantly fight with the number of ambulances. It's a daily firefighting for us. We cannot generate enough resources to tackle the aging population. We know that Western world is fighting the aging population, and as you say, for simple test or monitoring, they just, you know, they don't know where to go, and they come, and then we have a crowding in the PD. So the impact is worst for the patient who is really sick. Okay, and don't forget the hospital-acquired infection, especially the aging population. Imagine a clean cardiology patient coming and waiting in the emergency with the sepsis, you know, around, and they get the hospital-acquired infection. It could be CD with the anything which is probably not good for any intervention. So considering this time that how to triage before they reach the hospital, and this was our idea to leverage the data available on the platform, like we were using the operational AI applications, and we thought, oh, it's never going to change crowding in the ED. Corridor care started after the pandemic. But after this technique, what happened is that we can treat at home, and I think this is a concept new for long-term plan, that treat patient at home if it is possible. By the presence, there are already enough skilled physicians, advanced care practitioner, GPs, take help from them, treat them. Nobody wants to come to the hospital and wait for 17 hours for small things. If it is a blood test, hospital at home. We incorporate the hospital at home. We spoke to the community fidelity team. We made a lead. It's a 4 million investment there. We created community same-day emergency care, routine blood tests, even including the troponin CRP, which can detect just a simple pneumonia or sepsis. Do you really need to come to the hospital? And it's going to the telemedicine. We have a camera, body cam on the ambulance crew. We can do the point of care test there. We can do the ECG. We can detect arrhythmia if it is like something serious to come back. And then the fact is used 45 to 50 ambulances every week. We can stop. We can treat them there. And this is not only the treating at the site, where they're like, it could be nursing home, it could be residential home. They're really very difficult to bring into hospital. So that's not the only thing. We have 5 days follow-up or monitoring. That's a better care. Even if you come to the hospital, we can guarantee you a bed, that's it. And then you go to the different specialty, and then you get maybe for a dementia patient. So I'm just giving you some examples of how we brought change to this aging population with the comorbidities, treating respectfully, dignity, and everyone wants to be treated at home in this age. Second thing, for our team, burnout is very common in emergency care. We cannot create a lot of emergency consultant, emergency doctors. I can't create even nurses, because this takes a lot of time to train, educate them, and make them, apt for the UVC. Is a different way of working. So for that, I think we did a data analysis. After launching this project, we could save trolley times and 32% times more spending on the real patient. Like patient with the myocardial infarction, they are going to the cath lab, patient dying in the sepsis, pulmonary embolus, aortic dissection. So our mortality suddenly start going down in favorable. So that's the impact of technology, and that's the impact of any idea you conceive, and then you just get the unmet need.
That's very nice, Dr. Singh. And that's the point where I would like to also speak about prevention. Because for me, primary care is prevention. And as I told you, the disease is first manifested in your biofield. And because in your biofield we have all the trauma, the experience, your mindsets, we have to find a way to discover what is the blockage. And there are many researches from my colleagues, professors, where they see that the disease is manifested to a certain point of your body, depending on the quality of the energy field. So we have technology, and we also are willing to make more research to find a way to prevent the disease before being manifested to the physical body. So this will take a lot of load from the health system, but it also will not make people going to the condition to become sick. It's just a click in the mind, but they have to discover where is the click is. So I would love to ask Dr. Alexander to tell us about her philosophy, her innovation, because what she does, I'm a great admirer, and I'll be delighted to hear more.
Thank you, Nico. Yes, well, as I mentioned in the introduction, really the innovation that wanted to come through was a remembering that mind body is one word, and then training to embody that and to practice that in the oncology clinics. But I wouldn't mind for a second zooming out a little and really looking at the topic at hand, which is medical care and physicians as innovators. And if you take a moment to just sit with these two words, physician, innovator. Often, at least I'll speak for myself, when I was in medical school and when I started practicing, these two words didn't go together. I didn't know how to be an innovator. I didn't know what innovation meant for me. I also didn't know that I had permission to innovate. And my journey, ultimately, to bring forth the innovation that decided that it wants to come through me, really was a journey of getting to know myself and giving myself permission to know that I am an innovator, but also to hopefully carry this message forward and give others that same voice, that each and every one of us are innovators in our own ways. And innovation can be small steps. Innovation can be Tesla and Elon Musk. And they're both equally important. And something that I had to sit with personally as all of this was unfolding was I had an identity attached to being an oncologist and a drug developer, and all of a sudden here I am on what it looked like the other side, bringing holistic care. And it took me about 3 years to come to a place where the two are one. And at a place where 1 + 1 equals 1,000,000 and doesn't equal 2, because it amplifies. And how do you know that that innovation is right? How do you trust that voice? Because it lights you up inside and it serves. And so really that's the zoom out that I wanted to just offer for a moment and give that perspective of yes, physicians are innovators, physicians can be innovators. There's examples here, and it just so happens the 6 of us are here today on the stage, but it could be any one of you. And the innovation comes in various different ways. It can come simply by choosing to ask a different question in your clinic, and it can come through developing a novel method to streamline your services, developing an app, and caring for performance groups.
Unmet groups.
Unmet groups, exactly. So it can look every one way. So removing that stigma around what innovation is and what it needs to look like, I feel for physicians is really important.
Yes, totally agree. I believe you have to think outside of the box. Otherwise, you will be doing the same things for all of your life. And that stands for humanity also. So people that question and want to see, can I do it better? This can be an everyday challenge. The way from your home to your job can be a challenge to change it and find a better way. So that's what the innovation stands for me. But I will ask Dr. Aaron here to speak about his part and his innovation, and then we'll finish.
Yeah, I suppose for me, the innovation came about because of need, and it was commissioned by vans and agents themselves. I happened to be a doctor working in their space, and they said, well, we really could do with some physios. We're 45 dates into this run of 90 festival dates or 90 stadium shows, and we're all aching. We've all been traveling in economy, we've not been sleeping, we've got jet lag, we've got muscle tension in our necks, our backs, some of us have sciatica. Can you put on a physio clinic for us? So I said, when do you need it by? And I think it's taking those kind of risks or stepping out of your lane a little bit. That's where the innovation came, I think. So the more time spent in that, and I think, well, what do these people need? They need continuity, they need someone they can trust, they need access, they need someone who's relatable, who understands their work-life balance, someone that understands the friction of leaving family to then go on a 90-day tour, the entry friction, the exit friction. So it's not just physical health alone, it's psychology and their social well-being as well. And then the more I got to think about it, it's like, well, how can we provide a one-stop shop, with Radiomedic, this service for the touring community? And it's like, well, they have problems with noise-related hearing loss. So go and reach out to some audiology companies. So Oscilla in Denmark, they've given us a bunch of portable audiology screening devices. So we can do some preventative work and say, well, look, this is, you're losing your high end here. With the right hearing protection, that can be optimized. You won't get tinnitus, and you won't get depressed, and you won't have insomnia when you're in your 50s and 60s if you start early now, to the 25-year-old drummer that's on tour. We had, the physio thing that we looked at, but then we also looked at the vocal health aspect. What can we do? So Raybox, shout out to Raybox, they've been kind enough to support us with some vocal health tools. So there's things, something called straw phonation. So this is something that if you went to a conservatoire, wonderful, your classical training will teach you loads of vocal health coaching and techniques, to produce great sound reliably. But if you started out like the K-pop band that I looked after, who started out busking in Seoul, and are self-trained musicians, and you go from busking every couple of weeks, playing bars, to then doing 45 dates in 90, where are you getting that support? So then it's to help emerging artists and also those that are more established, and giving them an easy port of call, a one-stop shop for those solutions. So it's just thinking laterally about the needs of the population you want to serve, and it's really care to get to understand them and talk to them. And for me, it started out as reverse commissioning. They asked me to do it rather than top down. I decide as a clinician this is what you should have. So it's always listening to them, the patients, and the clients.
For me, that's caring. And from this point, I remember that we were speaking about immigration. And the modern immigrants are not immigrants because they are in a war zone. They're immigrants because they are people that have ambitions, they want to work, they want to connect and move to other cities. So one of our doctors that will be presenting in the academy is Dr. Josefa Akotekwi, that he is a psychiatrist, doctor, professor in Barcelona, and she developed a Ulysses syndrome, and we are training doctors how to deal with patients with the modern immigrants with the Ulysses syndrome protocol. So groups that are moving are not only rock bands, there are also people that are moving because they want to become better, to have a better life. And medicine has to support these people also. So a few minutes to Yvonne to present her vision for the future.
Well, my vision for the future is educate the doctors better, sorry. But I think they already, in 2018, the medical faculties realized that they have to, are failing actually the system, and that they have to educate the doctors better. And I'm a holistic practitioner, so I'm not a doctor, but my patients, when they come in, they ask me, are you a doctor? And I said, unfortunately not, because I'm an out-of-the-box thinker, and to be honest, the doctors, and of course not every doctor, is more narrow-minded because of their education. And in October last year, I followed a three-day conference from India, and the doctors were talking about, every doctor all around the world, from Australia, USA, South Africa, India, Pakistan, and they all apologized because they are realizing now that they were lack of information to help their patients the best way. And that's why it's so important that we start to educate doctors better.
I think you know, to sort of put the elbow in there, I think my generation definitely, biopsychosocial model is what we're brought up on. So I started in 2004 and graduated in 2010. And biopsychosocial model, holistic care, is the norm for most UK trained graduates now. So I think it's catching on to more other traditional areas of medicine. So there is hope.
Yes, there is hope, and we have to put science in this hope and make it practical. Yesterday, a fellow doctor from Athens sent me a video, and this video shows the time the ovum conceives the sperm. And there is a blast of energy and of photons at that moment. And photonic energy is a communication system of the cells of the body. And the collagen network is like a network of photons making a coherence in your body to communicate. So these are things we have to discover, to research. And because, photons are multidimensional particles, we can understand that there is something in other dimensions connected with our physical body. And this is a point that we're going to connect researchers in our academy. We are willing to make collaborations with medical institutes that want to have a holistic department, and my team of educators will be delighted to create something together. So we are all visionaries. We want to change the world to become a better place. And technology is a challenge itself, because technology can create miracles, but it can create destruction. So we have to be aware, to be educated, so that we can make good use of technology. With nuclear power, we can destroy civilizations, but we can create power for people to live. We have free energy. So the same stands for AI, and the same stands for the ability of our mind. So we have to use it in a proper way, transmitting the right frequencies. We are transmitters. The thoughts are outside our brain. So what you transmit, what you breathe, what we exhale is very important. And we have to see about the collective energy. We are a collective energy unit. And when we're speaking about breathing, when you breathe deeply in a hospital, you breathe some low energy. You can feel that. But when you breathe in the forest, you breathe some high vibration, harmonic energy. There are technologies that stimulate these environments. My colleague Donna is communicating with the EES system. So there are so many things we can discuss. We are open to make collaborations. But also, I would like some final words for mutual panels. What are your expectations, Wisdom? What are you expecting from this
Well, this conference is and has been a great opportunity to show that physicians and innovators working together, and there could be, as Alexander said, one person. And innovation in medicine right now, or in health, it's not a luxury item anymore. It's a necessity, because we are facing a huge problem worldwide with double aging population and also aging medical professionals. And the gap between the two is increasing. We can't close the gap by throwing more money. We can't buy emergency hospital physicians or nurses. We can create them within 2 days. I think with innovation on multiple fields, and one of them is the technology, we can close the gap and at the same time keep the quality of health services at a certain high level, which we all want and aspire.
That's nice. So a few words from you, Dr. Singh, to conclude, a conclusion, a few words to close.
Yeah, I think I agree. They say the necessity is the mother of invention, and this is necessary at the moment. From this conference, doctors are trained, like in my time, as a heroic healer. If they need to work 15 hours, they think this is part of their job, which is changing. And I'm glad that I came here and I see a lot of innovation, a lot of ideas. So when I go home, back, and because I'm faculty for my medical college, I will speak to the educational directors that could we have some kind of a entrepreneurship skill embedded in their curriculum to bring that innovation. It could be idea, okay? It could be simply struggling with the chopstick, how to make the noodles, okay? But it has to be, listen properly, and how could we, convert into, with the help of technology, to something very helpful for the medics, patient, and overall for the community. That's my message.
Just a few words, Dr. Alessandra, for conclusion.
I'm going to pass it over to my two colleagues here and
Yeah.
close us with the process.
Okay.
Yeah.
Well, again, despite all the innovation technique that is already here and will come, to be honest, I still think we are forgetting about nutrition. And I'm coming back to that time after time after time, because it's so important. With good nutrition, we can work more preventive, and then we need less innovation in telemedicine and all these kinds of things. So start where actually the start of your health is, and that is with good nutrition.
Absolutely. I think in the touring world, we talk about, we want to make the easiest decisions also the healthiest decisions. And so it starts with nutrition, it starts with your conditioning beforehand. I think, to kind of sum up on innovation in general in healthcare, I think it's for the clinicians of us that have never stepped outside the box, is to kind of think of that one question or that one issue that's nagging at you, and maybe just take that step forwards and think, how might you address it, and really take that risk. Because a lot of us really want, we're highly trained, very intelligent, very capable people, and you can be an innovator. And I think to take that step, think laterally, bring in, borrow from the other rooms in the conference, from CXO, I was there yesterday, some really great insights there. Borrow from other fields and solve those needs of the current population and now of the future.
Thank you very much. So now we want to close our panel, and I would like to ask the organizers to put this lovely song that my colleague Alexandra would love to, if it is possible.
So as we wrap up, we're going to have some music playing for us, and I'm going to suggest something radical for the next 2-3 minutes. And that's if I could ask everyone to put their phones down. Are you willing to do that for us? Innovation is an experience. And innovation cannot exist without intuition. You all have it. So what I'm going to ask you to do, for those of you who feel comfortable with that, you may want to close your eyes for this. Relax in your chairs. My fellow panelists, if you'd like to do the same, uncross your feet. Put your hands in your lap, palms facing up. And breathe. And breathe. Notice how the chair that you're on is holding you. Notice that your feet are touching the ground below. Notice that you're held. Take the next breath through your nose. I'm breathing with you. And on the exhale, tell yourself internally, I am present with my breath. And on the next inhale through the nose, and exhale through your mouth, tell yourself, I am safe. On the next inhale, touch your right hand with your left hand and tell yourself internally, I am present to this touch. On the next inhale, notice that you're hearing my voice. And tell yourself internally, I am present to what I hear. On the next inhale, through your nose and exhale through your mouth, tell yourself, I am here. On the next inhale and exhale, give yourself a little nod internally, maybe even a high five, acknowledging your journey thus far. Acknowledging how far you have come. You each know your own story. And let the words I'm about to say land, and let the parts of you hear this. You are an innovator simply because of who you uniquely are. And on the next inhale, ask yourself, what is the innovation that wants to come through me now? And just wait to hear what your body has to tell you. What is that message? You may get it as an idea, as a thought, as a body sensation, or it may be nothing at all right now, and that's okay. There's no right or wrong here. You're doing great. Pay attention in the hours, days, and weeks to come about the synchronicity
rush through our panel, and while I'll give the room a moment to come back, yes, you can just relax for a second. I'm going to ask our panel to stand up, take a step to the front of the stage so we can get a lovely group photograph for all our innovators and amazing ideas that have actually come to life through your dedication. For the room, are we back here? Yes, we've connected back down. So on the first day, we were told about $1 million idea. Can anyone tell me what those 3 little words were? I love you. Yes, it is I love you. Instant smiles across the room, instant dopamine hit, and that is just for you. So I would like to continue. Thank you so much, panelists. Thank you, doctors. Thank you, innovators. Thank you very much. Thank you, thank you.